Indications for surgery and radioiodine therapy for thyrotoxicosis. So let me say, first of all, you need to define the terminologies in this question. Thyrotoxicosis is simply what? There's an elevated levels of thyroid hormones in the body. Then surgery for thyroid hormone is what? Surgery for thyroid is what? Thyroidectomy. Radioiodine is just a therapy to just what? Maybe attend to disease of the thyroid gland, right? Then what's the meaning of indications? Indications is what is necessitating, okay? What is making you consider to do a surgery or radioiodine therapy, okay? So first of all, let's define it. We say that thyroidectomy is a surgical removal of all, that's total thyroidectomy, or partial, that's partial thyroidectomy of your thyroid gland. And the thyroid gland is indeed what? This butterfly-shaped um, organ that is in the front of your neck. Okay. Then talking about the radioactive iodine therapy, this can help to treat what? Hyperthyroidism. That's when your thyroid hormone is producing too much hormones, and it can also be used to treat some certain types of thyroid cancers. The term radioactive may sound frightening, but it is a safe and generally well tolerated treatment. It targets thyroid cells specifically to permanently destroy them. So if the thyroid cells are producing too much, then you might want to reduce the number of thyroid cells. They do a radioactive iodine therapy. So indications. What are the things that might make you consider to do a surgery or radioactive therapy? If the patient prefers it, okay, so if there are many other options to solve their condition, you discuss with the patient, and the patient prefers either surgery or radio iodine therapy. Simple, you do it. Okay. Then if the person is having what? Persistent side effects, maybe they are being treated from hyperthyroidism or any thyroid or cancer, so there are too much side effects, you might just want to what? Do a surgery, remove the thyroid, okay, or do a radio iodine therapy and reduce the number of thyroid cells that we have. Then the person is not responding to drugs well. Trying to give drugs, you don't want to do surgery or you don't want to start those therapy, but the person is not responding to drugs, and okay, do all those. Then if there's a recurrent hyperthyroidism, even after you have treated it what? 80 days. What is 80 days? 80 days is what? Anti-thyroid drugs. These are drugs that are against the formation of what? Thyroid hormone. So you are treating a patient, you are giving them anti-thyroid drugs, but the problem is going and coming. You might just want to do surgery or radioiodine therapy. Then, if there's a large goiter which does not remit after anti-thyroid drugs. So let me say if the person has an enlarged thyroid gland, and even after you have been given anti-thyroid drugs, this goiter is not coming down or it's not reducing in size. You might just want to do a radioactive iodine therapy, or you might want to do what? A surgery for that. Okay, so these are the indications for surgery or radioactive iodine therapy for thyrotoxicosis.